Effects of age on the muscular system. One other system that deteriorates with age is the muscular system. At a young age, you carry a large amount of muscle mass in your body composition because being active keeps your muscles strong, and you are also able to build muscle due to tearing fibres when you train. Having bigger and stronger muscles is important when you're young because they help to support a growing framework, and they also allow individuals to do well in their sports. This is because having bigger muscles that you can continue to develop allows adaptations of muscle fibres. For example, if you do a sport that uses fast twitch muscle fibres, such as sprinting, you are able to train your muscles in that sport so they produce more of these fibres than they do slow twitch. However, if you're young and do long distance sports, you may train your muscles to adapt to using and making more slow twitch muscle fibres, as these, unlike fast twitch fibres, create slow, continuous and sustainable muscle contractions. At around the age of 30, it is common that you will reach your peak muscle mass. This is where your muscles are as big as they can reach unless you train them to become bigger and stronger. However, after this peak, your muscle mass will begin to very slowly decline. Therefore, it is important to keep exercising to keep muscle mass at its optimum level for as long as you can. As you age, your muscle mass decreases, which is one reason as to why we may see metabolism rates drop in an older body. When exercising or when doing everyday jobs such as mowing the lawn, we burn calories. This is because our bodies are using them for energy, and as we lose energy, we lose the calories too. Metabolic rate is normally high when we are younger because lean muscle contributes to burning calories. Muscle typically burns more calories per hour than fat does, therefore increasing the body's metabolic rate. However, as you age, you lose lean muscle due to doing less exercise, naturally causing a decrease in the body's ability to burn the calories. This is also a reason as to why we see older people putting on more weight as they age. They are not able to burn the calories that they eat as efficiently as they could when they were younger. Furthermore, it is common to see an effect of age on the muscular system because of changes that occur in the endocrine system. As you age, the hormone testosterone decreases, which also decreases the muscle mass in the body, as this hormone generates the ability for our muscles to grow in size. As men and women both have a level of testosterone in their body, women's being typically a lot lower, you would expect to see a decrease in muscle mass for both genders, which leads to an instability of joints as they age. This causing a greater risk of people falling because their muscles cannot support their skeletal system efficiently. To help this, the older generation could do low-impact aerobic activities, as this will build muscle but with lower risk of breaking a bone, as these are also more fragile in older people at this time. Linking this to flexibility. According to WebMD.com, physically inactive people such as the older generation can lose as much to 3% to 5% of muscle mass each decade after they have reached their peak muscle mass at around the age of 30. This decrease in muscle mass is called sarcopenia and is common in the older generation, who are less likely to be able to take part in frequent exercise due to their body systems deteriorating. As muscle mass continues to decrease, it causes a reduction in levels of flexibility for older people over the age of 30. This is because your muscles become shorter and also smaller, so there is a smaller range of movement and the muscles restrict the joints from being able to move in so many directions. Muscles become smaller and shorter due to increased levels of fat. As you age, you typically put on more weight due to lack of aerobic exercise, which is what helps you to burn the calories. This means that over time, fat takes the place of muscle, causing there to be less muscle in the body. Furthermore, as you age, your muscular system changes because tendons become stiffer. When you are below the age of 30, your tendons are very flexible to allow movement to occur in the joint. This is important in sports such as football, where joints such as the ball and socket joint of the hip needs to have a great range of movement so the leg can abduct from the body. However, as you age, tendons are not as flexible and they are stiff due to loss of water and collagen, which is what makes them elastic and pliable. The table on the screen showing normative data for the flexibility sit and reach tests provides us with data to support the lack of flexibility that older people seem to have. From the age of 46 to 55, the number to reach a higher rank decreases, which shows that older people find it harder to reach further on the box. This is linked to their muscular system, as their tendons, ligaments and muscles have less stretch to allow them to reach forward further. At the rank of 50 on the left, 18 to 25-year-old females must reach to 20 inches. However, for a 65-year-old, they are only required to reach 17 inches, which shows a difference between the flexibility of a young person compared to an older person. According to Cathé.com, April 13, 2019, tendons lose collagen because of reduced blood flow, as when you age your heart rate decreases. Having less blood going into the fibres of tendons means they are receiving less oxygen and nutrients, which makes them not as able to regenerate tissue, and therefore they cannot stay as healthy. This is called cellular senescence. This is to do with cellular repairs not being able to take place sufficiently, which causes tendons to lose their structure over time. This is a disadvantage to the older people and impacts the older generation because it means that joints are not as mobile, which puts them at higher risk of dislocations. Therefore, if the older individual is still quite athletic, it is important to consider these changes so that they can focus on taking part in low-impact sports such as walking or cycling, as this is not complete weight-bearing, this will help to reduce the danger of dislocation and tears of their tendons.